It's already recording, so you don't have to do anything.
Hello, my name is Mary Spate, and this morning I will be informing you on post-traumatic stress disorder. According to the Merriam-Webster Collegiate Dictionary, post-traumatic stress disorder is a psychological reaction that occurs after experiencing a highly stressing event outside the range of normal human experience, and that is usually characterized by depression, anxiety, flashback, recurrent nightmares, and avoidance of reminders of the event. As reported by Adam Medical Encyclopedia, psychological, genetic, and physical factors are involved with post-traumatic stress disorder, but the precise cause of this disorder is unknown. It's characterized by a change in the body's response to stress affecting the body's neurotransmitters. Post-traumatic stress disorder is also referred to as PTSD. In a published article on helpguide.org in 2012, Melinda Smith and Dr. Gene Siegel reported the traumatic events that can lead to PTSD. Include war, natural disaster, car crashes, terrorism, sudden death of a loved one, rape, kidnapping, assault, abuse, and childhood neglect. Adams Medical Encyclopedia states that there are three main categories of post-traumatic stress disorder: reliving the event, avoidance, and arousal. First, reliving the event disturbs daily activity, including flashback episodes and repeated upsetting memories of the event. Second, avoidance includes feeling detached, emotional numbing, and lack of interest in normal activities. And third, arousal includes difficulty concentrating, having trouble falling or staying asleep, and irritability. In addition to providing the three main categories, Adams Medical Encyclopedia also provides information on other health issues and a diagnosis for PTSD. People who suffer from PTSD may also have other problems with their physical and psychological health. Problems can range from depression, alcohol and substance abuse, and related medical condition. A diagnosis for PTSD is made based on observations of the symptoms. The main factor needed for making a diagnosis is how long the symptoms persist. PTSD is when symptoms persist for more than 30 days. Acute disorder is when symptoms persist for a shorter period of time. Although the cause of post-traumatic stress disorder is unknown, there is treatment available to increase the chances of a better outcome. Melinda Smith and Dr. Gene Siegel presents the 4 treatment types and 4 goals for PTSD. The 4 different types of treatment are trauma-focused cognitive behavior therapy, family therapy, medication, and eye movement desensitization and reprocessing. The 4 goals of treatment are to explore thoughts and feelings about the trauma, work through feelings of guilt, learn to cope with and control memories, and address problems that the anxiety disorder has caused. Most importantly, someone who is suffering from anxiety disorder must know that he or she is not alone. Statistics provided by Michelle Rosenthal show 70% of adults in the United States have experienced some type of trauma in their lives. Up to 20% of the 70% people go on to develop post-traumatic stress disorder. About 8% of Americans have PTSD at any given time. Among people who are victims of severe traumatic experience, 60% through 80% will develop post-traumatic stress disorder. Almost 50% of all outpatient mental health patients have PTSD. Ultimately, there are many Americans suffering from post-traumatic stress disorder on a daily basis. Post-traumatic stress disorder affects everyone involved, including friends, family, and healthcare workers. Seeking early treatment for post-traumatic stress disorder is the best way to achieve a healthy lifestyle. Thank you.